Three. So we're going to be doing a central dressing change today. The first thing that we have to do though is make sure we check the chart and confirm the doctor's order. There is a central line dressing change every 7 days. It is that 7th day, and this is for Crouch Daniel. So we're going to go ahead and gather our supplies. We need heparin and saline and 2 masks, a biodisc, and some Curos, and some gloves. Alright, so we would enter the room, hand hygiene, close the door, provide privacy, introduce ourselves to the patient. Hello, my name is Jay. I'm going to be your RN today. The doctor has prescribed a dressing change for your central line, so we will go ahead and do that. But before we begin, can I get your name and date of birth? Crouch Daniel, 4/21/1973. All right, we have the right patient. And can you confirm for me that you have no allergies? No allergies? Okay. Sweet. So now that we have that information, we can bring over our supplies. And I'm going to grab a few gloves. And sit you up. For this procedure, we both have to wear masks, so I will place one on myself and you, and I'm going to have you turn your head away from the central line. So you can go ahead and put on your gloves. A mask on myself. I probably wouldn't do this in real life because somebody else has probably used this. And a mask on the patient. And they are laying flat for this procedure, and we're going to go ahead and have you turn that head away. Drop this down. Get everything settled. All right. So now we are going to peel away the bandage from outside, working in towards the central line. And now that that's done, you can inspect around the central line. You're going to look for signs of infection, inflammation, or infiltration. There doesn't appear to be any of those. We're also going to check for the sutures and make sure they're intact. And you need to note the length on the catheter when it's placed. All those will be documented at the end. So now that we have that, we can go ahead and open our supplies and begin placing a new dressing. I'm going to open this away from us. And before we get into any of that, we need to put on our sterile gloves. Going to This is always the hardest part. And I ripped that so I would get some new gloves from the CNA. I'd have them bring me in a new glove. But we will pretend like that did not happen. Okay, and now we can grab our supplies out of here. And we're going to look for the stick first so we can cleanse our central line. So you're going to break that, and then you're going to place it directly over the wound for 30 seconds. And once this 30 seconds are done, you're going to work your way out in a circular motion away from the wound. And when you're done working your way out, you're going to wipe the lines on the way out. And you are going to dispose of that. And now you are going to go ahead and place your biodisc, and you're going to make sure the blue is to the sky. All right. And now you can go ahead and grab your dressing to place on the wound. This one appears to be sticking a lot more, so and then you have this tape here that you can place for your date, time, and initials, which you will place there, date, time, and initial. And you completed the dressing change, but now you need to go ahead and flush all your lines with saline and do the heparin as well. So we have, we need another saline. Could I grab another saline instead of 2 heparins? Thank you. So we have our saline, and we need our, in here, we need our lock, saline lock there. So you can place this, and you do have to prime it. It is now primed, and we will place it in here. And now you do need to grab a alcohol swab. Take that off, I will grab this. And you are going to take off the previous lock. And and you are going to alcohol swab it for 30 seconds. And we will say that has been 30 seconds. And now you can lock on your saline. And you're going to use the push-pause method for this. So you will push, pause, push, pause, push, pause, all the way until you have 1 ml left, and then it's a push, clamp. And now you can grab your heparin and do 1 ml of heparin. I like to squirt it out so it's not more than 1 ml. And it can squirt like that. So you can go ahead and lock that on. And this one is a push and clamp. So you're gonna go ahead and push, clamp. And you do need to Kuros afterwards. And you place your Kuros on the top. And you do that for all 3 lines, same technique. And that is how you do a central line dressing change. And you do have to document on the way out and hygiene before you leave, and you're going to lower the bed. And you can take off the patient's mask